we try to understand what predetermines or predisposes patient to have venous stenosis with IIH and venous stenosis with pulsatile tinnitus alone. And we looked at features on MRI scan. We looked at the type of stenosis. We looked at the length of stenosis. And what we correlated this likelihood is that the presence of a long segment, what we consider like as an extrinsic stenosis, is predominantly seen in patients with IIH. And the short segment intrinsic stenosis is predominantly associated with pulsatile tinnitus. And this is not like one-to-one. Again, it's higher likelihood for each group, and there is some overlap, but this is the analysis we had at the time. And other factors like, having an empty cella, for example, or having tortuous or marked optic nerves has some input, but not as strong. So the type of stenosis helps correlate with the patient's symptoms, and that's an information that we offer out there. And this is an example of predominant. This is from the same publication, like a long segment stenosis, the brain parenchyma compressing the vein against the skull. This is predominantly IIH population versus the more focal stenosis, intrinsic, like an arachnoid granulation, like this filling defect in the venous sinus, more associated with pulsatile tinnitus. Again, there is some overlap. This is not 100%, but it's a good correlation.